In the United States, there are nearly 450,000 burn injuries that require medical treatment annually.
We see approximately 250 burns, inpatient burns in our unit a year. We interact with actually infants from the age 4 days all the way up to age 17 years.
What are the most common types of burns requiring treatment?
Common types of burns that we see amongst our patients are skull burn injuries, which are about 90% of the burns that we see. Probably somewhere between 8 to 10% of them are flame burn injuries. A lot of those are accidental injuries, and then other than that, contact injuries when young children grab a hot object like a curling iron or a regular iron or touch a stove.
What is the average course of treatment for a child with a burn?
For a patient who comes to us either through transport or from our ER that has a fairly superficial, maybe partial thickness burn, we will take them to the treatment room, which is very kid-friendly. We use moderate sedation, so our critical care team works along with the plastic surgeons, and the child is asleep. We will debride the wound. We give the parents education on what they need to do with the burn at home, which normally with the types of products that we send them home with were one-day admissions. They don't need to do anything but keep them clean and dry. And they follow up in the plastic surgery office in 5 to 7 days, and at that time when they take it off, usually the burn is healed.
When receiving treatment and dressing changes, children may benefit from being distracted in a variety of ways.
So we use distractive therapies for 2 different reasons. We use distractive therapies during the treatment rooms in order to engage the child in looking at maybe an iPad or toys that we have and engage them in that so they're not focused on their actual burn and what the doctors have to do. And then we also use distractive therapies when they're in their rooms, because having a burn injury, even though it may be covered and it may not hurt during that point, it may be itchy or they may be focused on it mentally. So we use distractive therapies at the bedside like a Nintendo or books and games and puzzles and things like that to kind of get that one-on-one interaction so that they're not thinking of their injury.
After receiving treatment, it is important for children to have a sense of normalcy, especially if their burns require them to stay in the hospital.
The playrooms are great use of distraction. We have a lot of children that maybe have a burn on their left hand and they want to come upstairs and they want to play, but they're not necessarily they're holding and guarding that left hand. So we would work with them to maybe play a game and encourage that hand to be used, but it also provides a sense of normalcy. Children usually go out and play. They go outside, they stay inside, they play games, they go to school. Those are all part of their normal days. So having a playroom in the hospital is essential in helping those kids move, get around, and feel normal.
It is important to always be aware of the hazards that can cause burns that are all around us each day. By being aware, we can be vigilant about preventing burns from happening to all children.